So day one really is about collecting and finding your studies and coding data from those studies. And really, it's not about meta-analysis per se. So we've saved that for day two. And so as we'll talk about today, you can do a systematic review without a meta-analysis. You could actually do a meta-analysis without a systematic review. We're going to encourage you to always do, the two together. But really tomorrow is going to focus on effect size calculations, synthesizing effect sizes, and the quantitative techniques that come along with doing a meta-analytic systematic review. So that is our agenda for the next 2 days. And really just to quickly overview the goals that we have set for this workshop is really by the end of tomorrow, our goal is for you to be able to describe the different types of research questions that you might actually be able to address using systematic reviewing methods, to identify and structure your own systematic review topics. So today we're going to have some time for you to work on your own systematic review questions. And it sounds like a lot of you are actually in the midst of this right now, so this should be a useful exercise. But for those of you who maybe aren't, we can at least brainstorm some ideas for some systematic review topics. Then we want you to be able to be familiar with the steps needed to conduct a systematic literature search and to gather relevant studies, to develop a coding protocol, and so that's essentially your data collection form. So of those studies that are going to be included in your systematic review, what's the survey instrument, if you will, that you're going to use to survey those studies? And then really there's a large literacy component. So this is a lot to teach in 2 days. I usually teach a semester-long graduate course on systematic reviewing and meta-analysis. So really, even if you come away thinking, gosh, that's a lot of work, we want you to be informed consumers of systematic reviews and meta-analyses so that you can read those reviews, understand them, and be able to critically appraise them. And then we want you to be familiar with reporting standards, so we'll talk about PRISMA and kind of the guidelines for reporting systematic reviews and meta-analyses. And then really we want you to have a working knowledge of the tools available to conduct a meta-analysis, so that's the quantitative synthesis, and then to provide you with the resources needed if you do choose to do a meta-analysis. So those are our goals. So before we get into the meat of the workshop, I'm just going to pause there. Are there any questions, comments? These can be housekeeping things. Everybody's got their Wi-Fi, the most important thing. And really this workshop is designed to be interactive. So as soon as you have a question, please feel free to ask it. I'd like it to be interactive. Yes, Judy.
What would you say?
Oh, Mike. Yes.
What would you say is the difference between the Cochrane collaboration and the Campbell?
So the question was, what is the difference between the Cochrane collaboration and the Campbell collaboration? And so really it is the content matter. So Cochrane is really focused on issues of health and medicine. And as we'll talk about in just a minute, the Campbell collaboration was developed out of the social sciences. And so the content is focused on education, criminology, social welfare, international development, so more social sciences. Now, the Cochrane collaboration and the Campbell collaboration do have a working affiliation, and so you can imagine there are content areas where there is overlap between Cochrane and Campbell. And so you will see some systematic reviews will be co-registered with both collaborations. So they're actually published in both libraries. And we have a very good working relationship with Cochrane. I would say, in terms of size, Cochrane is much bigger. They've been around a bit longer, and Campbell is a little bit smaller. But really what's defining is the content. Great question. Other questions before we get started? Okay, so what we're going to spend the next, and I realize I probably should keep the agenda out, so I'll stay on task. What we're going to start with this morning is really thinking about, just a general introduction to systematic reviews. It sounds like many of you actually have some experience with systematic reviews, so this isn't going to be new information necessarily. But then we'll focus on defining review questions, thinking about the scope of your systematic review. So what is a systematic review? We've already used this term 500 times and we haven't defined it. Well, I think it's easiest to start by defining what a systematic review is not. Okay? So who was it that said, I've done lots of unsystematic literature reviews, right? We heard that. Who said that? It was you, Jay. And so we know probably most of us have done a traditional unsystematic literature review before where we go out and say, okay, I need to find the literature to support some claim X. So I'm going to go find studies that support that claim and then review them in kind of a narrative summary. Now, these narrative descriptions of prior research, we know that there are limitations with this unsystematic approach. So one problem is what sometimes has been called cognitive algebra, which is how do you actually summarize or synthesize the results from a body of literature? There's really not a systematic way that you do that in a traditional literature review. And because of that, there's no systematic way for somebody to be able to replicate your findings from that literature review. Another big problem with these traditional literature reviews is that they often rely on what's called vote counting or counting up p-values, right? So you found 10 studies in the literature, 5 of them had a significant p-value, 5 of them did not. Okay, what do you do with that? And so we know that counting up p-values is a bad idea because p-values are tied to what? Sample size, right? And so this is a big issue, especially if you think about people working in disability research areas where a lot of primary studies have smaller sample sizes. Those primary studies may be underpowered to detect effects. And so even if you've got 10 studies with non-significant p-values, does that really tell you that there's no effect in the population? Well, that's a problem with these traditional unsystematic literature reviews. And so when we do systematic reviews, we're going to try to overcome some of these inherent biases in the traditional literature review process by essentially not just focusing on p-values, but we're going to use meta-analytic techniques to actually focus on effect sizes instead of p-values. But we're also going to use a structured way to identify studies. We're going to use a structured method for collecting data from those studies. And we're going to use a structured way to synthesize or summarize the results from the studies that we've included. So really, it's trying to overcome a lot of these kind of lack of transparent methods that are pervasive in these traditional literature reviews. So systematic reviews, by definition, try to identify, collate, and systematically summarize the empirical evidence from 2 or more primary research studies. Okay, and so whereas in a primary research study, your unit of analysis might be an individual, a parent, a family, a school, a community, those primary studies themselves are the units of analysis in a systematic review. So this is a literature review where you're just trying to undergo identifying and synthesizing studies in a systematic way. And so that's why we use protocols, which we'll talk about this morning. And so protocols really are your plan for your systematic review, where you outline, here are the types of studies we're going to review, here are the types of data we're going to collect from those studies, and here's how we plan to synthesize those results. And the logic of using a protocol is that you're then not using the kind of cherry-picking technique where you're going to pick out the findings from the studies that say what you want them to say and perhaps omit the findings from the ones that do not. In systematic reviews, we're going to have transparent literature search strategies because, again, the idea is that somebody could come behind you and replicate your literature search and get the same findings that you did. We're also going to pay close attention in a systematic review to study quality. So in most traditional literature reviews, you don't see much discussion about quality. That's a big issue in a systematic review because if you've got a bunch of low-quality studies, giving you evidence of an effect, you may not be as confident in that effect as if you had just a few high-quality studies. So we'll talk about this afternoon some strategies for collecting data and coding data on quality. And then finally, systematic reviews are really nice because we can synthesize findings in a systematic way. And so as I sort of hinted to earlier, you can synthesize findings in a systematic review qualitatively, so narratively, but you can also do it quantitatively via meta-analysis. And so that really is going to be the content of day 2, where we talk about, okay, you've got these findings from these studies, how can you quantitatively, statistically summarize those findings? So why conduct a systematic review? Probably over the next 2 days, you're going to realize, if you didn't know this already, that doing a systematic review is quite labor intensive. It takes a lot of time, a lot of energy. You need a certain personality type, I would say, to enjoy keeping track of all of these things. But why do we go through all of this effort? Why don't we just do those traditional literature reviews that you could do in a couple of hours? Well, there are a lot of benefits to systematic reviews. And so I think the first benefit is that by synthesizing findings across primary studies, we can get increased power to detect effects of interventions. And because I'm coming from a Campbell collaboration perspective, I really am going to be talking mostly about intervention effectiveness reviews. But meta-analyses and systematic reviews don't have to focus on intervention effects. But if we're thinking about intervention effectiveness and thinking about the policy and practice implications of primary research studies, it really is unwise for us to make policy and practice recommendations based on the findings of a single study, right? Because that single study, we know, may be subject to its own potential weaknesses or potential biases, but that single study may not generalize to other contexts. It may have statistical power issues, and so on and so forth. So systematic reviews then increase our ability to make those policy and practice recommendations by saying, okay, let's not just focus on the results of a single study, but let's say what's the current best evidence in the field at this time. So really we gain power by summarizing and synthesizing findings across multiple studies. And so we already know that some people are familiar with the Cochrane collaboration, but Archie Cochrane, who was kind of the godfather of the Cochrane collaboration, he was famously quoted in 1979 as saying, "It's surely a great criticism of our profession that we've not organized a critical summary by specialty or subspecialty, adapted periodically of all relevant randomized controlled trials." And I think this quote really sums up nicely in the late 70s and early 80s the kind of need and drive for systematic reviews of the relevant evidence base, and really this understanding that we can't just make policy and practice decisions, and really in Cochrane's case, making medical decisions based on a single study. We really need to be able to look at the totality of the body of evidence to make these policy and practice decisions. So really systematic reviews have come into the foray, I think, as the evidence-based practice movement has gained ground and the evidence-based medicine movement, because part of that evidence-based practice movement is that practice and policy decisions need to be based not only on clinical expertise and client preferences, but also our understanding of the current best evidence. And that current best evidence really ideally should be based on the totality of the body of evidence rather than a single primary study. So how many of you in this room are familiar with survey research or have done survey research? As I expected, almost all of you. And so I like to put up this table. It's from Julia Littell's book on systematic reviewing, which is a great resource, and it's listed in your recommended readings. And they make these nice parallels between survey research methods and systematic reviewing research methods. And I like to highlight this just to say that what we're going to cover in the next 2 days, it really isn't too new. There are going to be some fancy new words that perhaps you haven't heard before, but most of the methods that we're using are very similar to the methods that you use in survey research. So we're going to start by developing our research questions, just like you would if you were conducting a survey. We are going to then design a protocol that's going to outline our data collection and data analysis procedures. We will then develop a sampling strategy. And so in a systematic review, that's typically an attempt to sample the entire population that's available to you. Then we'll use standardized data collection forms. So just like in a survey research study, you might go survey a person. In a systematic review, you survey a research report or an article or a dissertation. And the data analysis phases are also very similar to what we might do in survey research. So we're going to look at descriptive statistics. We're going to maybe look at some means and some standard deviations and some variances. If we see variability in effects, we might try to explain that variability in effects using regression type techniques. So this is not new. We're going to use, things are slightly different when we're talking about meta-analysis, but the concepts and the general strategies are the same. And then with reporting, just describing your results, presenting your results in a straightforward, transparent, replicable manner. Okay, so let's talk about systematic review organization. So Judy already asked about the Cochrane collaboration. There are lots of organizations that are dedicated to the dissemination, production, development, promotion of systematic reviews and meta-analyses. And so many of you may be familiar with some of these. I've just listed the ones that I'm familiar with, but there are many more. Okay, so Campbell is just one of many organizations, but I'll talk a little bit about what makes Campbell unique in just a second. So the Campbell collaboration is an international network that supports the production and dissemination of systematic reviews and meta-analyses, but really it focuses on systematic reviews on topics related to the effectiveness of social programs, policies, and practices. Now, when we talk about developing your research question, again, you don't have to focus on interventions or policies or practices. You can look at assessment tools, you can look at predictive validity, but really because this is a Campbell training, we're going to be focusing more on kind of intervention effectiveness reviews. And so the Campbell collaboration then has its own journal called Campbell Systematic Reviews, or sometimes called the Campbell Monograph Series. And so we publish essentially the protocols and completed reviews for systematic reviews in these topic areas. And I apologize, I now realize that we've omitted one recent group. We have a crime and justice group, an education group, international development, social welfare, and we now have a newly revitalized knowledge translation and implementation group, our KTI group. And they are recently a new group, which is why they're omitted here. And so they haven't actually got any published reviews in their group yet, but we have several in the works. So really this is the content area, but again you can see how some of these, especially in social welfare, some of these content topics may overlap with Cochrane, in which case we might have co-registered reviews with Cochrane as well as Campbell. So here is a link to the Campbell website, and I just wanted to show you, we've got lots of resources on here. The website is currently being redesigned, so I apologize, it's a bit clunky if you go on there. But we do have a resource center. One of the most useful things I think there is David Wilson's effect size calculator, which if you haven't checked that out, it's very useful if you want to extract effect sizes from a variety of different sources of information. And it's kind of an easy tool that you can just use online. But there are also nice resources there for kind of recommendations for systematic review, literature searching, kind of study appraisal, things like that. But what I wanted to point out here is that if you went to Campbell Systematic Reviews up at the top left, that will essentially take you to the database of our libraries, and this is the database of the journal where you can look up completed reviews. And so the library does actually include both protocols as well as completed reviews. So you may see some projects where the protocol has been published, but they're still working on the completed review. I don't think we have any reviews without protocols. That's a different entity. And then really you can see then if you wanted to search by education or by social welfare, you can do that. So I'll talk about this in just a second when we review kind of starting a review and doing a scoping review, going to the Campbell website, going to the Cochrane website or some of those other organizations is a great place to start to see, has somebody done a systematic review on this content area before? But these can also be really good resources for you to look at literature search, search strings for like PubMed or ProQuest, but also code books. So most of the completed protocols or reviews will have the full code books available, and so you can use that as a template if you're developing your own. So these are a great place to start. So I'm going to pause there and see if anybody has questions about sort of Campbell in general, as an organization, the benefit of systematic reviews. I know we already had a bunch of believers in the room, so that was kind of an easy sell.
Were you going to talk at any point later in the day about title registration?
We don't have that formally in the slides, but I can certainly talk about that right now. Or we can maybe talk about it tomorrow afternoon, but I'll briefly foreshadow that. So remind me tomorrow afternoon if we haven't talked about it enough to go into more detail. So essentially, if you want to publish with Campbell, the first step is for you to actually do a title registration. And so that's where you submit a short form. I don't know, it's 3 to 4 pages, where you say, here's my topic, here's my proposed title for my review. Here's my research question, kind of general overview of the strategies that you're going to use in your systematic review. You would submit that to one of the coordinating groups, so education, social welfare, KTI, international development. And then once you have submitted that title registration, the editor for that group reviews it, make sure it doesn't overlap with any of our existing reviews, and provide some initial feedback. For instance, if they say, really, this is a great idea, but I don't think it's feasible, or, here are some suggestions that might make this a more reasonable project. But often, if it's a solid topic, it goes through title registration fairly quickly. And once the title is registered, and you'll see in the database, you actually can see the titles that are registered, that's when you would start to work on your protocol. And then the editor of the group that you're working with would help you develop that protocol, give you feedback on that protocol, and essentially those protocols and those completed systematic reviews go through peer review, just like any other article that you might publish. And the peer review that we do, which we actually pride ourselves on, is quite extensive. So you not only get feedback from content matter experts, but you also get feedback, editorial comments from the methods group. Sometimes we'll get librarians to help vet your search strategy. So we give you a lot of feedback at that protocol stage to ensure that you're on good ground to start your project. Yes?
Yeah, so just a really quick question. I looked around on the website. Are you affiliated with Don Campbell from?
Yes.
Okay.
So that is that's where the name came from, was Don Campbell. Yes. It was not on the website that's where the name came from. Well, the website is clunky. It's probably there, but it's like 50 pages deep. But yes, Campbell does come from Don Campbell, the famous social scientist, who was, yes. I know, and I had a picture of Archie Cochrane. I should have had a picture of Don Campbell. Other questions? Yes?
When you mentioned title registration, how does that fit in with, I think earlier you mentioned Prisma registering, so how does that fit in together?
And so Prisma is really the reporting guidelines for a completed review. And so with the title registration, that's just you essentially reserving a content or a topic matter and saying, I'm going to do a review on this subject matter. I'm going to reserve that. Please don't give that topic to another review team if they come along. Prisma, on the other hand, so if you think about your title registration as reserving your topic, your protocol is your plan for analysis, and your completed review is the final product. That final review, you would want to abide by Prisma's reporting standards. And that's really just reporting requirements. So ensuring that you report the number of studies you identified in your literature search. There's a 28-point checklist, and actually the Prisma reporting guidelines are in that training manual that you received. So really the Prisma are reporting guidelines, so that's just structuring what's in that final review.
What about Prospero?
Prospero, so essentially Prospero is a database where you can register essentially a protocol for a systematic review. And really that's beneficial if you're planning to publish your review elsewhere. So that serves the purpose of having a protocol that's publicly available so that you can say, we registered our review, here's what we're going to do a priori, and then our final review, we actually followed that protocol. So in Campbell, you don't need to do Prospero because you actually have a published protocol that's available. But essentially, if you were planning to do a systematic review that you were just going to publish on your own or publish somewhere else, it's always a good idea to register with Prospero so that way you have that published protocol. Other questions? Yes.
Do you use identical methodology as the other
Cochrane
collaboration does?
It's not identical, but it's very similar. So Cochrane, again, is mostly interested in reviews on intervention effects. And so I would say the systematic review methods are almost 100% identical. Even the meta-analysis methods per se are almost identical. I would say what's different is actually, I would almost call it an epistemological approach to systematic reviewing. And that varies by review group, but in general, if I were to speak in generalities, some of the Campbell groups are more open to you asking broader research questions, whereas with a lot of Cochrane reviews, because again they're focused on health and medical interventions, they are focused on very narrow review questions. And we'll talk about that in a minute when we talk about review questions, but that has implications for the types of conclusions that you can draw. So I'll give you a few examples. So one Campbell review that I was involved in, and which you'll see in your training manual, was looking at the effects of interventions targeted to reduce dropout among high school students. That's a very broad research question. So we didn't care about a specific type of intervention. All we cared about are interventions that happened in school settings during the high school years that were intended to reduce dropouts. So these could be mentoring interventions, they could have been life skills training interventions, they could have been tutoring interventions, work skills interventions, but really what we wanted was all of those interventions that predicted dropout outcomes, and then we wanted to compare the effects of those different kinds of interventions. So that's a broad topic. You don't see broad topics like that in the Cochrane Library so much, because they're typically interested in providing evidence that physicians and nurses can use to provide more personalized medicine approaches to their patients. So they may be interested in more narrow types of questions. For instance, does glucosamine work better than a placebo for reducing arthritis symptoms in adults ages 50 to 55 with histories of osteoarthritis? So it's a much narrower question, but it's useful for physicians or healthcare practitioners who are making those decisions for a specific type of patient. So I would say not all Campbell and Cochrane reviews are broad versus narrow, but that is one of the biggest differences you see in approach, and that has implications for your methods. Does that help?
It seems that the scope of review is quite different. One is very narrow and the other is broader. However, in terms of methodology, whether you include meta-analysis or not, is it exactly the same?
It actually is a little bit different, because as we'll talk about tomorrow, it depends on how you think about heterogeneity or variability. And I would say that most of the review teams I've worked with who have broad scope review questions think about heterogeneity. It's a very interesting thing that they expect to see in a meta-analysis, and they want to see in a meta-analysis so that they can use statistical methods to then explore that variability. Whereas in those narrow scope reviews, heterogeneity is sometimes, I like to say that people consider it a dirty word, right? So if you see heterogeneity, it's a bad thing, because if you're only interested in estimating a mean effect size, heterogeneity then means, well, you've got variability. Whereas in those broader scope reviews, you're often not interested in a mean effect size, but you're interested in a regression model and looking at variability in those effects. So I think it doesn't change the statistical methods you use, but it changes how you use those statistics. I don't know if that, and I think this will become more clear as we start to talk through these and give you some more examples. And I do want to say that this dichotomy that I've just set up does not apply to all Cochrane and Campbell reviews. We have plenty of Campbell reviews that are very narrow scope questions, and there are actually quite a few Cochrane reviews that ask broad scope questions. For instance, in their public health group, they have quite broad topics. But just to give you a feel for the similarities between Cochrane and Campbell methods, so Cochrane developed some guidelines for the methodological expectations of the reporting of and conduct of systematic reviews called, I guess they call it MECIR, MECIR. And so this is, several hundred items that they have. It's kind of like Prisma, but a lot more detailed. And so essentially they have these reporting guidelines for the conduct and reporting of their reviews. Campbell adapted those for Campbell reviews, so they have their own adaptations, and I was part of the team that worked on those adaptations. And really the adaptations were quite minor. So things like using fixed versus random effects meta-analyses, using double coders for screening, they're very minor modifications. So really we're more similar than we are different. Other questions? Okay, so let's start thinking about topic formulation. And so really when we're talking about topic formulation, I'm referring to developing your research question, developing your eligibility criteria, and then your coding manual. So thinking about planning your review. So here is just a nice diagram that outlines some potential stages when you're conducting a systematic review. So stage 1 is when you're planning the review, and so this is really topic formulation. So what I'm going to cover is, first, asking yourself, do we need a new review on this topic? Second, convening a team, and so this is very important to think about who is going to be on your systematic review team. Then defining your research question, and then developing your protocol, which has your eligibility criteria as well as your coding items on it. Stage 2, identifying studies, selecting studies, and conducting data extraction. Really, that's what we're going to talk about this afternoon when we talk about doing your literature search and then collecting data from those studies. And then really the quantitative synthesis is what we're going to cover tomorrow, and that takes a whole day, and really we could spend a whole week, 2 weeks on that. And then reporting and dissemination, we've already touched on that a little bit, but there are some standard reporting guidelines, so the PRISMA and the Messier guidelines that we can use to make sure that we've reported everything we need to in our systematic review. So let's talk about, first, identifying the need for a new review. So before you embark on a several month-long, at least, project to do a systematic review, you need to determine whether you actually need this review. So first you need to go to the literature and do kind of a preliminary search to make sure another high-quality systematic review does not exist. So I always start by looking at some of those systematic review organizations that I mentioned, so Campbell, Cochrane, ARC has a database of their systematic reviews. Depending on your field, maybe Joanna Briggs, Epicenter. You might also look at Prospero, which we mentioned earlier, which is that registry of systematic reviews. So perhaps somebody's going to do their own systematic review, not with Cochrane or Campbell, but they may have registered it with Prospero, so I would look there as well. But there are also specialty journals like Systematic Reviews, which just publishes systematic reviews, so you might search there as well. Now, as I always tell my students, of course you don't want to panic if you see that somebody has done a review on a topic similar to yours, because then often you'll find that perhaps their scope was slightly different. Maybe they were interested in a different participant age range. Maybe they included different types of study designs that you're not interested in, or they excluded some that you are interested in. Maybe they didn't look at outcomes that you want to look at, or maybe they did a poor job, which is also a reality. So maybe they didn't do a very good literature search. Maybe they omitted gray literature. They only looked at published literature. So you want to read the reviews and make sure it's a high-quality systematic review. But often you'll find that there's still a gap that you can fill in your systematic review. But certainly you want to look to make sure before you embark on what will be a long process. And then the other issue, too, is you might find a review, but it's outdated. Right? So if we think about systematic reviews as being useful because they provide us a nice, concise picture of the current best evidence in a field, current is important, right? So if you've got a systematic review that only reviews literature from the 1980s and 1990s, well, that may have been useful, in the early 2000s, but perhaps that's not going to be as relevant for the clients or populations that you're working with today. So also you want to think about timeliness. Yes?
So what is good systematic review etiquette if you find that somebody's already registered a title but they don't have a protocol yet, or maybe they've put up a protocol, but they haven't put up the review? Like, what's good etiquette and whether you can kind of work in that space or not?
Well, I mean, I think it varies, depending on review teams. Some people may be more collegial than others. I would say that if you found a title that looked like it was in the general area that you were interested in, but it wasn't clear, I would certainly always email the people and say, hey, I'm interested in doing this systematic review. Do you have a protocol that's available? I'm just trying to make sure that we don't duplicate effort. So I am always in favor of reaching out to people. But you may find people are unresponsive, and if that's the case, then you need to think carefully about what's your unique contribution, as you would in any kind of research study, right? So if you find their protocol and you do see some limitations in the quality of their methods, then I think it's free game for you to do a higher quality meta-analysis. I think in terms of outdated ones, you could always email the authors and say, are you planning to update this? Because, even if they're not, they might be willing to collaborate or to help or to provide resources or citations from their older review. So I'm always an advocate for reaching out to people, and if they don't want to be collegial, well, you can't force it. Other questions? Judy?
Oh, I had a comment and a question. At least as far as the Cochrane reviews, I've seen protocols in their database that have never been finished.
Yes.
So there's no review, really.
That's true.
Yeah.
And so did everybody hear that? So Judy said in Cochrane at least, and it's true with Campbell as well, there are going to be protocols that may be like 5 years old, and there's no completed review. And that can be for a variety of reasons. And so with Cochrane and Campbell, I think both are moving towards an initiative to essentially retire those and to open those topic matters back up. So if you did find a topic, where the protocol was really outdated and you're wondering why it's still there, you could certainly email the editor of the group and say, hey, I'm interested in this topic, can I take that over? And that's always a possibility. And they'll work with the prior review team, say, you've got right of first refusal. You can say that you still want this topic area, but after a certain amount of time, if no movement has happened, other folks could take on that topic area.
And then I had a question, too.
Mm-hmm.
As far as the Campbell collaboration, are all the systematic reviews indexed in PubMed?
So the question was, are Campbell reviews indexed in PubMed? I am not sure. I think we are indexed. I know that we were working on it. So we can always do that as a test when we play with PubMed this afternoon. I know that we as an organization have been working on that. I'm not sure if it has come to fruition yet. Other questions?